We're connected.
All right. Good morning. I'm Cynthia Schendel, and I serve as co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call and to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Andrea Perdomo Morales, not here yet. Donna Honer-Quayle. Sarah Behrens.
Here.
Jasmine Cohen-Young.
Present.
Mary Gill.
Present.
Good morning. Mike Gillette. Not here yet. Leanne Gendry.
Here.
Yolando Johnson.
Present.
Catherine Reck. Not here yet. Christy Sanders.
Present.
Good morning. Eric Schonecker.
Present.
And Robin Unruh.
Here.
Great. I note the following BSRB staff members are also present: David Fye and Leslie Allen. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Cynthia. And Leslie will not be joining us this morning, but I did see Catherine Reck in the meeting. I think her audio may not be working, but I do see her on the Zoom call.
Okay, good.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment to contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On October 14th, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meeting. The notice is also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the conference call line, but if I hear someone beep over and announce themselves, I'll let you know.
Okay, thank you, David. So our first order of business will be to approve our agenda. Hopefully everyone's got that email with the agenda attached. Do I have a motion to approve the agenda as written, or are there any additions or deletions?
This is Leanne. I make a motion to accept the agenda as written.
Thank you, Leanne. Do I have a second?
I second.
Great. All in favor? Aye.
Aye.
Any
Aye.
opposed? Thank you. The agenda was approved. Next, we will approve the minutes from our last advisory committee meeting, which was on October 1st. And again, those minutes were attached to the email that David sent out. And hopefully you had a chance to review those. Are there any corrections or additions to the minutes as provided?
No.
If not, I would entertain a motion to approve the minutes as written.
This is Leanne. I make a motion to approve the minutes as written.
Thank you, Leanne. Do I have a second?
Second.
Thanks, Eric. All in favor, aye.
Aye.
Any opposed? Motion passes. Thank you. Next, we will have a report from David, our Executive Director.
Thank you, Cynthia. And Perdomo Morales is in attendance as well today.
Oh, good.
Go ahead and mark her as present. Well, it's nice to see everyone. We are going to give you a couple updates on BSRB operations. Things are running well here at the office. One of the items that we've been working on with one of our partners recently has been our partnership with a company called CE Broker. We've talked about them a little bit over the past year, but the board has partnered with them. They're an independent company, and the service they provide to licensing boards and licensees, similar to what the BSRB has, is they essentially provide a platform for individuals to upload documentation of completion of continuing education. So it's a free service to the licensing agency, free service to the licensees. We are encouraging people to take advantage of this. Basically, if you complete a CE, you can upload your documentation and assign it to a specific category. So if it's an ethics hour, you can assign it in that way. If it's an hour related to diagnosis and treatment, you can assign it that way, or if it's a general hour, you can do that as well. And then when you renew your license, if you are selected for audit, the traditional method would be that we would follow up with you, request documentation to prove that you had taken all of your CEs before you had renewed. Under this method, if they're all uploaded to the portal, we can log into the CE Broker and confirm the documentation and then approve your audit right away. So it's also a nice tool for licensees that you don't have to just hang on to all that documentation on the possibility that you will get audited. It's a nice record-keeping tool for licensees, but it also should lead to some efficiencies with our auditing process. So when we did make that agreement with the eBroker, one of the main conditions that we made sure was in our contract was that it would be voluntary for licensees. So no one is required to do it. But like I said, I encourage all licensees to do it. I think it's a nice, helpful tool for you. And if you are ever audited, it should make that process go smoother and a little bit quicker. So turning next to another item, we are fast approaching the legislative session. So in Kansas, every spring from about the middle, maybe the beginning of January until sometime in April or possibly May, sometimes as late as June, the legislature holds daily meetings. They have standing committees. They hear bills, review agency budgets. And so I will be active over at the Capitol this spring. Our agency budget is always reviewed separately by the House and Senate. They make recommendations, and then it moves forward to an appropriations bill for the state. We don't receive any money from the state, but they do set a yearly limit on how much we can spend of our available funds. Second, we also go over if the BSRB ever requests introduction of a bill. We try to get the bill across the floor and passed into law. Usually these are things that are intended to help protect the public and also make things a little bit easier sometimes for licensees. And so we have a number of different items the board has already discussed in terms of items for the legislative agenda. Additionally, the board will be meeting Monday, December 16th, to finalize items for legislative agenda, and then we'll have a clear idea of what to go forward with this legislative session. If there are other bills affecting the BSRB, I'll probably be over there presenting testimony or answering questions from members of the legislature. So I wanted to give you a little idea about that upcoming part of the process.
David, can I ask a quick question? Do we know who's going to be heading the Health and Human Services Committee yet, since Brenda Lenoir is retiring?
Yes. So I did see an announcement last night, actually. There was some information that came out that they have done appointments, at least on the House side. I haven't seen a list of Senate appointments yet, but on the House side, the new chair of the House Health and Human Services will be Representative Will Carpenter. And I don't know if any of you are familiar with Will Carpenter, but he's been in the legislature quite a few years now. He's been very active in a lot of the health committees. He has served a number of years as the chair of the Social Services Budget Committee. So he is familiar with especially mental health and health-related agencies. So I'm really excited to see him in that role. I think last couple of years, he had served as chair of House Fed and State, if I believe correctly. So he's been in the legislature for a few years now and played an active role concerning health agencies. So happy to see him in that new role and looking forward to kind of talking to him about anything the BSRB has an involvement with this year. So.
Great, thanks.
Every advisory committee meeting, I do like to keep you all updated at items from past board meetings. There was a board meeting recently on Monday, November 4th, and we have quite a few items on our agenda today for the advisory committee. So I'll just kind of keep to some high level items here. But one of those things, there was an important announcement. I had attended an annual meeting for the Association of State and Provincial Psychology Boards, ASPPB. That is for the psychology profession, but that is the national organization for the regulatory boards. And there had been a proposal to basically change their examination. They wanted to require a second test as part of their examination process. They have a knowledge-based test now, and they wanted to include basically a second test that was based on assessing skills. And they were going to put these two tests together and refer to it as one test with two parts. But there was a lot of concern from states. Some states expressed concern about the cost of having to pay two separate fees, the high price of that test. And so there was concern. Ultimately, at the national meeting, about a week before, the board of that organization decided that they would go ahead and pause their requirement of both tests that was going to be coming up on January 1st of 2026, and start a task force to really work at implementing both topics into one uniform test moving forward. So I know this is a different field, but I think it's important for you to kind of know the discussions that are taking place in other areas. So I think the general consensus for the psychology profession was that there was still a lot of support for the current licensing examination, but requiring a separate test at a separate cost. That was going to be a factor that a lot of states were having difficulty with. And the way that it was being presented was, if you don't require passage of the second test, you will no longer have access to the original test. So there were some states that were going to be left without the ability to have a licensing examination. So thankfully, we were able to have good, constructive conversations together, and it did produce a good outcome. So in the future, they will come back, I'm sure, with a different proposal, but it remains to be seen what that will be. So wanted to give you a little idea about that discussion. That was an update that was provided at the last board meeting. Additionally, there were some different items that were touched upon in terms of recommendations from advisory committees. So we had talked a little bit in the past that under the Construction of Act statute for most of the professions, it basically says if you are providing services in this area, you need to be licensed under the BSRB. There are a couple of carve-outs, and that is for individuals who are students or interns, but there was some language in the Addiction Counseling Act and also the Marriage and Family Therapy Act that also had a carve-out for individuals preparing for the practice of addiction counseling or marriage and family therapy. And that terminology was a bit unusual, a bit vague. It really wasn't defined in terms of who that was intended to help or actually who that was covering. And so we had brought that to the advisory committees to say, do you want to try to define these terms? Or if this is not being helpful, could that be a recommendation to remove that language? And so both professions did make recommendations to the board to remove that language from the statute, and the board recommended also requesting legislation this year to remove that language. There would still be the carve-outs for students and interns, but not the vague category of individuals preparing for the practice of addiction counseling or marriage and family therapy. Additionally, there has been a conversation about supervision and who would be able to provide supervision for individuals seeking clinical licensure for certain professions. The profession that we received the most requests for flexibility is the professional counseling profession. A lot of individuals have requested the ability to use someone outside of that field. And so we had a good conversation with the advisory committee. We brought in feedback from the Kansas Counseling Association. The advisory committee and the Kansas Counseling Association held the value of saying that in general, with few exceptions, the supervision should be provided by individuals from that profession. However, we have heard that there will be individuals, in terms of trying to be helpful in workforce shortage areas, that they would like the ability and flexibility to have supervision provided by individuals in other professions that have at least a license under the BSRB at a certain level. And so the proposal the advisory committee ultimately reached as a compromise solution would be to request statutory language to require half of the supervision hours for professional counseling to be provided by someone who is a board-approved clinical professional counselor, but to allow for up to half of the hours to be provided by someone from another profession. So that is exclusive to the professional counseling profession, but they did say that they thought that would be a nice compromise solution to offer. And so that is something the board did recommend at that board meeting to move forward to statutory language for the legislature this spring. And then the last item that was a recommendation from the advisory committee had to do with the licensed psychology advisory committee. The language currently states that if someone received their education from an APA accredited school, it would still require the specific coursework in the education regulations to be met. So APA accreditation plus specific coursework. However, the advisory committee believed that if someone attended an APA accredited school, it was no longer necessary for the specific coursework to be met. But if someone attended a non-accredited school, that is when the coursework specific requirements would need to be met. So that standard does match more of the other professions in terms of what is required for individuals attending an accredited school versus a non-accredited school. So that recommendation was also approved by the board. So looking forward to a few other additional changes. At the last meeting of our advisory committee here, I did make you aware of some of the recommendations from the board at the out-of-town board meetings. So looking forward to kind of wrapping up that process and then preparing for the legislative session. But at this point, I'll go ahead and end my report and I'll see if there's any questions. And Cynthia, you are currently muted.
Sorry. Thank you, David. Hearing no questions, I will move forward on our agenda to updates from the ASWB meeting that David and I attended in San Diego last month. Do you want to give a summary, David, or do you want me to?
Why don't you go ahead and start, Cynthia, and then I'll kind of fill in with some other comments afterwards.
Okay. Well, it was a 3-day conference basically, and they presented a lot of information about their activities. Most of you are aware, hopefully, that about the data that they released. It's a year and a half ago now, maybe almost 2 years, that indicated that there were discrepancies in passage rates based on age was one, how long since you had graduated, and people from different races had differential passage rates. And so they have been working fiercely to counter that since that data was released. And we have learned since then that several other mental health professions have had similar data, as have other professions like law. They also have differential pass rates. And of course, the $64,000 question is why and what can be done to alter that. And so we have these 3 reports that, if we have time, we'll be discussing later in our meeting today, that they released to try to answer that question. And in the interim, they are providing some resources. For example, they have a module that they were providing for free to anyone who didn't pass the exam the first time. And it really addresses more kind of mental attitude towards testing, trying to shift the mindset to a more positive attitude towards the testing. They don't yet have data to indicate whether that module actually results in a higher pass rate, but they are now offering that module to anyone taking the test, not just someone who's taken it once and not passed it. So there have been 3 states that actually voted to not require the exam anymore. They still had representatives at this meeting, I noted. And I know that there was some noise about that at the time. And in fact, KU did recommend that we drop the exam, and as did NASW. Kansas did not choose to request that, but it's concerning because of the move towards deprofessionalization and deregulation in the legislature. So I was glad to hear what they're doing to try to define what is causing those discrepancies and to try to correct those discrepancies so that the test can be preserved. When we did do our survey of Kansas social workers about a year ago, I think, the overwhelming majority of social workers in Kansas that responded, and we had a good response rate on that survey, so indicated that they thought we should keep the exam. So the conference was very well run, and that it was a delegate assembly, so we elected new leadership for ASWB. And David, you went to the administrators forum. That was one day of the conference. Do you want to share about that?
Sure. Yeah, it is helpful for me to spend time with other individuals from different states that have a similar role that I have here. One interesting thing that I have seen in talking with different executive directors is that there is a trend that I am picking up, and it is that a lot of states recently are moving in the direction of the BSRB to form what is known as a composite board.
Yes.
Not every state has a combination of professions like we do here. Some states may have a separate social work board and a separate psychology board. The issue that some of those states run into is if you don't have enough licensees or the fees are not high enough to actually provide support staff, you actually have board members as the ones who are physically reviewing every application. And sometimes board members are the ones who are doing the actual investigations when there's complaints against practitioners. So board members are the ones, making the phone calls and collecting evidence and trying to summarize all that. And it creates some strange issues in terms of which hats are individuals wearing at different points in the process. And so over the last few years, and especially just in the last couple, I've noticed a number of different states like Utah and Iowa, and there was another one that just moved this direction. But basically what they're doing is they're taking their mental health profession, and if they have separate licensing boards, they're making them one board and having a couple different members from different professions on the same board with some public members like we do here in Kansas. And it's a nice way for there to be ways for the professions to work together. But it also addresses some concerns that they've had in some states where there was a recent lawsuit a few years back in another state where they basically said that there were individuals on a particular board for a dental profession that because of there being so many members of that profession and some of the actions they were doing, it created an issue with them controlling the market and not letting people, practice in certain ways. But with a composite board where you have representatives from several different professions, there's no way for one profession to have a controlling interest in some of those conversations. You really do have to work with each other. But you do still want to have conversations that relate to each particular profession. While there are some common grounds, there's still uniquenesses. And so another trend that I've seen is these states that are making composite boards like the BSRB, they are coming up with a subcommittee or sometimes even calling them advisory committee structure like the BSRB has, where you have a different advisory committee or subcommittee for each profession with representatives from that profession that can forward recommendations back to the board. So the ultimate vote is still the board, but it does involve a lot of members of those professions without having standalone boards. And so it makes me feel good about the process that we have. I have seen the efficiencies that we have, and I think one of the benefits is that we've been able to keep our licensing fees low because we have the combined boards or the combined professions that help us in this way. So I did offer assistance to a few other states in terms of how they can make that transition from having standalone boards to having one. Some of them were just a little overwhelmed at the idea of there being multiple professions all working together and how can they share this information. And so I shared a little bit of information about our setup with even the YouTube channel as a nice way for there still to be visible for the work of each of the professions, but also, the board itself. And so, yeah, really, really positive comments, feedback. What I've seen also is, a spirit of different states and provinces working together to try to find solutions to common issues. We're not all the same. And in some other professions, I have seen a little bit of sort of a territorial type thing. And even when it comes down to a state by state type issue, people want to address workforce, but they don't necessarily want to lose their own employees in the state that might leave and go to another state. But I've sitting at this national conference, I've just seen a lot of people working together, trying to find solutions and just trying to help with client continuity and a lot of other things. And so I agree, Cynthia. I thought it was a really well-run conference. There were some items that they discussed briefly in terms of next steps, in terms of more resources they'll be providing to different states. Some of that they've asked us not to share too much detail about because they're planning to come out in the spring with some big announcements. So I don't want to tease too much about that, but just to let you know, there is some good information out there right now in ways they're trying to help people. And in terms of the national examination, there is some information that we could talk about today from some of those reports that were put out by an independent researcher. But there's some additional work that is still going on there through that association. So really positive experience, good takeaways. And I always take down a lot of notes on things for short-term goals and long-term goals. So have quite a few to keep working on from that meeting too.
Yes, and also want to note that in the day that while you were at the administrators forum, I was with the delegates from all the states. We had representatives from 51 states and Canadian provinces, so it was quite a cross section. And I was hearing from some of them about the angst about combining boards. We're not the only state where the legislature wants to, try to reduce red tape or, consolidate, find efficiencies, et cetera. And but I was able to share some of the things that you described about the advantages of having a multidisciplinary board and how that has worked in Kansas, and came away generally with the impression that our whole regulatory process and some of the issues that people were bringing up, we already have addressed and have processes for, et cetera, that our whole regulatory process for mental health professions was kind of a bit ahead of the pack from a lot of the other states and provinces. And also just wanted to point out that David serves on the finance or budget finance committee for ASWB. So once again, Kansas is well represented, and by David's involvement, I think you also are our representative currently for the multi-state compact, and I think you're on committees for some of the other professions, their national organizations as well.
That's right.
Is that right? So that really gives us a great exposure when we get together for these national meetings, and helps our reputation, if you will, as a solid state with in terms of regulation of mental health professions. So really appreciate that extra effort, David.
Thank you.
Any questions or comments about the ASWB meeting? Okay, well, now we get to go on to our annual training for board members and advisory committee members. Any of you that have been are not new, you remember this from previous years, but David has been able to, was it Leslie that worked on that, or who worked on consolidating?
Yeah, so basically we have a staff member that previously had been a part-time permanent employee while finishing up a college degree, and she recently finished her college degree, and we received approval from the legislature to turn her position into a full-time position. So some of her new responsibilities is that she's starting to work in sort of an assistant role to me, and so she's going to be helping me with some of my responsibilities. And she was able to review the past PowerPoint and basically condense it from about 140 slides down to about 70 slides, to cut it in half. So that's really good. But I want to make sure that we cover the other items on the agenda. So Cynthia, if you don't mind, how about if we go ahead and skip over the training for now, and then we come back to it maybe with about half an hour left in the meeting.
Okay.
We'll have a chance to cover the other items, and then we can circle back around to it.
Okay, that's great. All right, well, moving on to old business then. We need to talk about our recommendations for any possible BSRB bill coming up in the new legislative session. Previously, this advisory committee had approved recommending that that bill would include a rescission of the change in the definition of clinical social work that was passed last year or year before last. And that was changed the language about the 1,500 hours of face-to-face contact diagnosing and treating mental disorders, and said it had to be 1,500 hours, including but not limited to diagnosing and treating mental disorders. And we had discussed that in this committee and at the larger board. And we're going to recommend that we try to reverse that. We also, they had also dropped out particular hours that you needed in your degree, down to only 3 hours of psychopathology. They'd removed all the other requirements, and this committee had voted to recommend that those be restored as well. We had a meeting with KNSW leadership recently, and because the larger board wanted us to meet with them and see if we could reach some agreement about recommending those things, because they were the ones, KNSW supported those changes and actually, championed them. And so we did that recently. We had a good meeting with myself and Andrea and David, who is our chair, and Laura, who's our vice chair of the BSRB, and several members of the KNSW board, including their executive director, Becky Fast, and their president, is it Tanya? Is that her first name, David? Yeah. And there were, I think, 3 of their board members present. And the upshot was that we thought the meeting went well in terms of us trying to find common ground, but they were very concerned about opening up the statute at all for any reason because of the current legislature situation that we have, where last they had a supermajority before, now they have a supermajority plus 3. And so the current legislature will be able to push through most things that they want to. And with them being very focused on workforce shortage and deregulation as a path to creating more providers, there was great concern on the part of KNSW about opening up the statute in any way because of the things that they could add. That's exactly how we got this addition last time. Was we opened up the statute, proposed a bill, and they were able to, the people who wanted those changes were able to get those tagged on. They didn't come to any agreement that those things should be reversed. They stayed focused on the dangers of opening up the statute at all, which sadly I think is true, that it would be risky to open up the statute because of the power to put through any changes that they might come up with that they think are going to, support this goal of deregulation and increasing workforce, making it easier to get licensed. So we wanted to come back to the advisory committee and ask your thoughts about this, whether you think we should still try to request these changes, or whether we should sit this session out in terms of putting forth those kinds of changes until we have possibly a less dangerous legislative environment. So I'm interested in your thoughts about that.
And I know Cynthia Andrea was in attendance at that meeting too. Andrea,
Yes.
Any other comments or takeaways from the meeting?
Thank you. No, I think that is just the question at hand, and unfortunately the scenario we have in front of us. So definitely would like to hear others' opinions as well.
Eric, what's your thought about this, whether we should try to move forward or sit it out this term?
Um, that was what I was kind of opining about, looking up at the ceiling here. I think probably my biggest concern would be is even if we push it off, do we think the political climate would even change in 2 years, 4 years? If anything, I think all the signs are sort of pointing towards a trifecta of Republican control coming to the end of the current gubernatorial term, making it where, I mean, we can continue to push things off, but I think by doing that, we're saying we don't trust the decision by the people who elected the politicians. And I don't know if that's necessarily our role either. So I have great concerns about reducing or improving workforce. But, I was recently talking with a CEO of a hospital, and they had just gotten back from a conference, and they said that even like hospitals in Kansas are projecting a 40% shortfall of personnel. So there's going, and by 2025, 2026, I think is what they were talking about. So I think there's going to be some hard decisions having to be made about workforce because it is an ongoing issue. I know within like the state system, we're way short. We're struggling even to provide services for the people currently enrolled, and they just took 500 more people off the wait list and have asked to push them into community-based services that are already strapped for employees. So I don't know that waiting it out is going to, I don't think that's going to happen. I think that we would continue to push it off. But that's going to be up to sort of everybody's decision. I just don't see the political climate in Kansas changing substantially in the next 2, 4, maybe even 8 years.
Cynthia, I saw Mary came off mute as well.
Oh, good. Mary. Thanks. Thank you, Eric. I think that's an important perspective. We don't have a crystal ball, unfortunately. Mary.
Yeah, I probably would want to sit tight on it. Yeah, just being unsure about what's coming and how things are going. It's that part is concerning to me, how it can be used. So
What else they might come up with if they had the opportunity.
Exactly.
Mm-hmm.
And I know there's other, I mean, then that affects other things and it ripples out. And I respect that. But I think right now it's tense and it's tenuous, and I'd rather sit on it right now.
I agree with Mary. This is Leanne. I agree with Mary. I'd rather sit on it because right now the political, it's just everything's up in the air right now. And my opinion is, we move forward right now, we might lose. It might just get pushed back, and we might not get it pushed forward ever.
Yeah. So far, we've not had anyone submit a training plan that does not include the 1,500 hours face-to-face diagnosing and treating. They can. It's since the statute was enacted, that's possible, but it hasn't happened yet. I do have concern that once that starts happening, once people start getting a clinical license with less than the same amount of training as all the other mental health professions have to have for an independent license, that reversing it at that point, that it would be a lot harder.
Right.
Because
I agree.
Those people will be out there practicing, and people will point to them and say, see, they're just as competent or whatever. Which maybe they will be, but we don't know. We just know that everybody else that it gets to practice independently has to have that standard. And I think it's potentially destructive to social work professionalism to allow a lesser standard for social workers.
I agree.
What does anybody else think? Dr. Cohen-Young, do you have an opinion?
So I'm just thinking from a insurance perspective when we look at credibility and making sure that competency is being met. They want us for our professionalism and knowing that we have the, the competency and the training that we do have, right? So I just think about it from that standpoint. Will we become, not as sought after, if I may, even from a federal standpoint, being in the federal sector, they look at us as highly skilled, right? Highly competent. So I would agree 100%, moving that marker and making it less does, spark that question of, are you meeting the same standards? Are you even looking at our ethics and how we are governed to practice, right? As social workers, that definitely does come into question if we move that marker. So I am in agreement here with everyone. I do think we should definitely hold off on this.
Hold off on requesting this change back
Yes,
to
ma'am.
the earlier
Yes.
standard?
Yes.
Okay, because of the political climate,
Right.
even though it's important to try to maintain. I mean, right now, well, I think this is a current statistic of about 60% of the psychotherapy in the country is done by social workers. So, if this change stays and we start to have, a cohort of social workers who are less well-trained, and maybe that could lead to more complaints. We don't know what the end result of that could be. But over time, I mean, we have something of a buffer because there's so many more of us than any of the other mental health professions that are practicing and providing services. But that could fade over time if we start to lose our credibility and the perception of our professionalism, et cetera. That would be a longer term impact. And I think Eric's right. I don't know, that we're going to have a more hospitable environment anytime soon in Kansas or maybe in the country as a whole. But I guess one question, David, is because all the other professions made recommendations as well, or several of them did, of what they would want to put in a bill if we put one forth this year. And so will those stand? Will we have a bill one way or another, David? And it's just whether we want our social work recs in there or not? Or we're not sure about that until we meet
So,
as a full board.
yeah, on the board has voted already on a couple of items to pursue in terms of the legislation. But the goal is to wrap up the legislative items at that meeting on December 16th. So it's kind of a special 1 hour board meeting just to touch on any kind of items that are still out there. The board could change its mind on a couple of them, but I know that there were a couple of different items that seem to have a lot of support. So there could be an overall discussion about, do you still want a bill to go forward this year? Understanding sort of what's on the table, and are any of these items timely, or are they things that, you may want to wait a year on?
So if a bill is put forth that has recommendations for the other mental health professions, that doesn't necessarily open up our statute, or does it?
Well, so the topic of opening up a statute is kind of interesting because, anybody can offer up an amendment in terms of committee members. And what I've seen sometimes is lobbyists or other people can talk to members of the legislature and say, could you please add this to this bill? And so it could be a brand new section that they want to have created to be added to a bill. It could be amending an existing statute that's listed in the bill, or it could just be referencing a statute that's not in the bill, but it has a similar subject area. So I can't say for certain that there's not a social work item in there that someone couldn't offer something up. It's,
Mhm.
it's possible.
That would be, and that could be a backdoor way to, if the BSRB is not proposing it, somebody else could propose the changes that we're asking for, or that the committee voted on here.
Yeah,
But it would not be through the BSRB.
right. Yeah, if the if the committees are discussing a bill, they have a lot of flexibility most of the time in terms of what they want to add, and some of those are directly from members of the committee, but some of them are they get requests from individuals to add certain things. So.
Other legislators.
Mhm.
Right, because this change was proposed by a legislator and supported by KNESW when it passed before.
Yeah, and it's an interesting process with the legislature because the BSRB cannot introduce a bill. Ultimately, it's members of the legislature that have the authority to request bill introduction. So we can go to a committee and request that a member
propose it, yeah,
or that a committee will introduce it. But ultimately, they're the ones that can introduce legislation, they can amend the legislation, but they can be influenced by people who come to them with different ideas or proposals. And so it may not have originated necessarily with a member of the legislature, but they're ultimately the ones that take the action to vote things into bills. So.
I know we still have others to hear from to weigh in on this, but just one thing as a possibility, I know that this committee and the board overall has been trying to do a really good job by being guided by the voices of social workers and doing surveys. And so one thing to put out there is that if we do decide not to open up the statute this time around, could we gather some data during 2025 to then be able to have that to make a more informed decision? Although we have heard from a lot of social workers already on this topic and others, but just that might be another way for us to gain some momentum to then present it in 2026 potentially.
Yeah, Andre,
go ahead.
I just was going to say, there was a survey of social workers just about a year ago, but since that point, the surveys that we have been helping the other advisory committees with, they've included some elements that were not in the social work survey that we did a year ago. So I do think, if we wanted to do another survey for social workers, there would be definitely new topic areas we could ask about, such as this topic, and also some questions related to workforce that maybe were not included in the survey we did of social workers about a year ago.
And I agree. I think having that data helps us decide what to press. But if I'm projecting, talking to the legislative committees, and they're not going to care a whole lot what the people in the profession think about what should be in that statute. They're going to care more about, creating a greater accessibility, more providers. But it would help us feel more confident, I think, about pressing forward if we get a strong response that most of the social workers that think that we should restore those standards. So I agree. I think that would be a good thing.
I have yet to come across a social worker that is an advocate for reducing our training in the clinical field. So that's concerning just overall where these messages are coming from.
Yeah, I agree. I haven't talked to anybody either that thinks that we should have less or certainly any different standards than all the other licensed mental health professions that have an independent level of licensure.
Yeah, this is Mike.
Yes, Mike.
Yeah, my thoughts are, if we emphasize the public safety and competency and concern that people practice within their areas of competency, by doing the additional hours, we actually have a way, I know I did, to kind of practice or work on my areas of competency and question, well, am I really competent in these areas? And should I maybe be more focused over here? and these other kinds of things. So I think if in all of this, if we're able to continue to emphasize our concern isn't just the social worker, no, our concern is the public. Our concern
Exactly.
is competency,
Mhm.
and that other professions have figured ways that they can attest to the competency of their people. We're not questioning that. But for social work, I know that this has been, at least personally, that I can only say
Mhm.
that really helped me. It helped build some confidence in some areas that I might have felt that I was questionable about my competency, as well as reinforce the emphasis that maybe I need to not do these things, but refer to this person, or refer to a psychologist, or refer to marriage and family therapy, someone in a different profession.
Mhm.
So I think if there's a way in all of this so we can continue, because that's paramount in so many of the things that David sent us to, is that public safety, and it's like the top of the reason that we have the board, or that we have the social work advisory committee. Anyway, that was my thought. Now, in terms of this issue, opening the door to questions, again, I think any senator, any congressperson can just throw it out there for whatever sake, whether they want a political headline or not. So the right timing, I have to leave that to people who are more political savvy than I am. But
Mhm. Good points. And actually, what you were describing about your experience in supervision, we've been revising the clinical social work supervision manual, and that idea of, because as social workers we are trained, you have all these roles you're supposed to be competent in doing, but within that you need to find the ones that you can be most effective, and that should be a part of the clinical supervision process, absolutely. And also, if you want to be a specialist in a particular area, then your training, your postgraduate training towards that specialist area should be in that area. I mean, you don't want someone doing heart surgery who did half of his training in podiatry, right? They're still a doctor, just like an MSW that does training in something other than clinical is still an MSW, but they're not, they don't have the specialty of being a clinician if they haven't done that training. Okay, let's see. Sarah, do you have a thought about this? Is Sarah still with us?
Yes, I'm sorry. My mute
Okay.
was not letting me unmute.
Okay.
I don't have any, I mean, mine would just kind of be the same as what we're kind of talking through, is kind of the back and forth of the urgency of not wanting to wait, but also understanding that you have to have the right timing, um, to really get what's best for the profession. So I don't know that I would have anything different to add. I'm sort of in that sort of space where I'm kind of riding that fence, if that makes sense.
Yeah. Okay. Yolando, do you have an idea about whether we should go forward with what we had previously decided, or whether we should hold off on asking for these reversals?
I think I'm kind of the same consensus as everybody else. Kind of hold off, due to a variety of reasons, but mainly not to, I guess, tear down the professionalism and the competency, of the profession. So uh, I would just say hold off.
So another part of what we had previously approved in this committee to go forward to the larger board was to propose a new specialty area, a new specialty license as a generalist. And ASWB actually does have an exam for a generalist specialist social worker. There not very many people take it. there aren't very many states that have a licensure in that area. But we had agreed to propose that as part of this reversal of the reduction in standards, because one of the arguments that KNASW put forward was, that there are a lot of LSCSWs that don't practice clinically. Well, of course, that may be true, but they're licensed to. They could hang out their shingle and start seeing clients at any time. So for those who wanted that highest level of licensure, because some agencies pay more if you have the specialist license, we were proposing a new specialist license. And so that would be also, if we choose to hold off, that would also be something that would be delayed. And we may want to revisit that piece anyway, because it's not a widely held specialty across the country. And it's not really clear what it would authorize people to do that they can't do with just their LMSW. The main advantage would be people who do not want to be clinicians would have another path to being a specialist social worker. And, we could have half a dozen of those if we wanted to. We could have a macro specialist, but I think the intention was for that to fall under generalist. So I think I'm hearing a general consensus that we should hold off on proposing these reversals, even though I think Eric's right that we may not have a more hospitable environment anytime in the foreseeable future. But that may mean that we just decide in 2 years or in a year, 1 or 2 years, to go ahead with it, even though it's inhospitable at that point. But given the sort of volatility of the political environment, it sounds like we all would feel better to take these recommendations back and put them on hold, because we had previously put them forward with the BSRB. So I guess I'd like to maybe have a vote on that, just to make sure everybody has an opportunity to weigh in. Anybody else have any other comments about this issue? So I would ask for a vote for holding back the recommendations, pulling them back and holding them for a year at least. We can revisit and see what we want to do in a year from now. So all those in favor of holding back or taking back those recommendations, please say aye.
Actually, sorry, Cynthia.
Oh, I'm sorry.
So there's 2 ways to do it. You could have someone do the motion, or you could do the motion yourself. You would just need to have someone second.
Sorry, I forgot
So moved.
Robert's rules.
Otherwise,
Second,
it also could be consensus if you just wanted to do it. Just want to make sure we followed one of the other paths.
Thank you. We did hear a motion and a second.
I'll
So
support.
thank you. So all those in favor of that motion, say aye, please.
Aye.
Aye. All opposed? Okay, sounds like that motion passes. The other old business that we had was, let me see where we are time-wise. Okay, we got a little time. Review and update of our social work supervision manual, and the draft of the timeline that we sent out. Eric and I have been working on that, and I consulted with Leslie and Tyra, who are the ones who actually, Tyra does the training plans for LSCSW candidates. And they made some recommendations, and also Andrea. So did you all have a chance to look at that? And does anyone have any comments, additions? We felt like it was important to give a clearer picture of what the whole supervision process looks like. If you looked at the existing manual, it has the regulations laid out and a rough outline of what's involved in providing and receiving clinical supervision, but it didn't have the sort of play-by-play, here's how you start, here's what has to be in place before you can start acquiring hours, and here are some topics and some things that you might cover in clinical social work, so that you get maybe a clearer idea of what that process looks like. I've heard from several people that had what they described as very unsatisfactory clinical supervision as they were getting their licenses. And I think it's important that we kind of solidify the idea of what a good clinical supervision path should look like, with hopefully still plenty of room in there for individualization of those plans.
Hi, this is Dr. Cohen. I just have one comment because I reviewed what was sent out, and sometimes social workers are very eager to get their hours completed. Is it possible? I think I have to pull it back up, but it talks about the time frame in which you can acquire your hours. Is there any way that there can be any verbiage added that states like what there we are. We look at number 3. Is there anywhere, or is it even just some verbiage that can be added where supervisees are aware that they can't have 5 sessions a week, or they can't meet like once a day or anything like that, because some are very eager to get this
Yes,
completed.
they are. It's actually in the statute or the regs, David, that it has to be a minimum of 2 years and a maximum of 6 years, I believe. Is that right, David?
So I believe that was the traditional language. I think the 6-year requirement has been removed. If not, it is one of the regulations that's working its way through
Right.
that year limit to be removed. But it does need to be in no less than 2 years.
A minimum of 2 years. But we could add that to this. I mean, I think that's in the regs that are already part of the manual that was produced earlier. But we could certainly note that in that section that you have to take at least 2 years to acquire those hours. So yeah, you can't do.
Okay.
I mean, there's only so many hours in the week, right? But I guess some
There
people
are.
think they could see 40 clients in a week and try
Yes.
and
And
run
then
it up.
also in the regs, just out of curiosity, is it so many hours, like you have to see clients so many hours per 1 hour of supervision?
We recently changed that. It used to be for every, I think, 15 clients, you had to have 15 client
15
hours, you had
hours.
to have an hour of supervision. But we removed that standard at
Okay.
last year. So it's but no hours that you work can count if you haven't had supervision for it.
Sufficient. Yes. Okay.
Add reference to.
And Cynthia, I did ask one of my staff members just to take a quick look at some of the language here. It seems like in number 2, the word treatment right here probably should be training plan instead of treatment.
Oh yeah, I went through and tried to. I missed that one. That was my mistake. Yeah, training plan.
Yeah. My question was just under number 1, and where it's trying to say that that the supervisor has some connection to the trainee or the person under supervision for their practice. And it says that last sentence that you'll have experience with the client population. That's fairly easy to say. The supervisee will be serving in at least partial responsibility for their practice. That's not really defined. It's at least partial. Well, liability wise, they're already on the hook there, but I'm not sure that statement is really expressing what's trying to be said.
Well,
Or
that's
really,
in the
I don't know what
statute,
it's saying. Pardon?
It's in the
Sta-
statute that you have to have at least partial responsibility. And earlier in the paragraph about you have to establish communication with their agency if you're practicing from outside the agency. David, are you aware of any more specific standard for what having partial responsibility? Because I think on the attestation form, the supervisor has to just check that they have partial responsibility for the individual's practice. When I supervise people from outside their agency, what that looked like was I would provide feedback to the agency for when that person had their review. And, there was contact information shared so that the people from the agency could contact me if they had any concerns about what should be covered in supervision, et cetera. But others may have handled that differently. Is there any more specific reg than that?
Not to my knowledge. I don't think so.
So maybe that's something we should look at is creating a clearer definition of that.
Well, you provided a much clearer definition than what I think that says, but it seems like if it could say that if it's from outside of that agency, there's clear communication with that agency of the current status or something.
So
anyway.
Maybe just an example statement, like, for example, you could, this would be a way to create that partial responsibility.
I like that. I take that this is a document that a person doing supervision would use to help in the writing of their supervision plan and to understand how they're going to provide this supervision. So yes, we're trying to be brief, but there might be some of it be nice to
flesh it out, right? That was kind of our thought in creating this whole supervision timeline, which this is a new piece that isn't in the current manual that is provided. And
I like the overall document because I felt like it really does help to give some help to a supervisor and also of a supervisee as they, what the expectations are in this process where we've not had this in the past. So.
Right. And I think in particular, we wanted the supervisee, even though this is for the supposedly for the supervisor, that we wanted a supervisee to have an idea of what good clinical supervision should look like so that, they can have some ability to craft their experience and maybe make sure that their supervisor is meeting their needs, like what you were talking about earlier, helping them figure out where their strengths are and what direction they should focus in their practice, rather than just, I've heard stories of people that just met for lunch and that was their supervision. So I think it's important for this to be something that we can really define and that show the seriousness of it and how important it is for our clinical providers to have adequate supervision, especially now that we've had this revision and what could be allowed as far as their clinical training. Any other comments?
And I would just add, I've done a lot of work in the federal systems, and I know that the federal people that I've worked with would take any of that kind of information very serious in terms of how it applies. But at the same time, they're not really forthcoming telling anyone else what they know.
Yeah. Yeah. So this would be available to everybody, hopefully. Other thoughts? Do you feel like reading through it that particularly Eric and I were looking at the, specific examples of topics that might be covered in clinical supervision? Do you feel like the whole timeline and specifically that, I think that's on the second page, maybe, David? Yeah. does this give a pretty clear idea, or are there other things that you might add to that list? We say it's not an exhaustive list. There may be other relevant topics for supervision, but is there anything else that any of you thinks should be one of the examples that we include there?
Should we add anything about safety in there?
Excellent point. Every licensed social worker in Kansas, the first time they get licensed, has to take safety training. But I don't think it's required as part of the annual CEs after that. And certainly being in private practice as a clinician has some different safety issues than in some other settings. So that would be a good thing to add. Social worker safety. Okay. Any other thoughts?
I don't know how important it is outside of just child welfare, but like I just know how important documentation is in. Is it that important?
Oh, you don't, I thought it was on
you
there.
got clinical. I'm sorry.
Yeah, clinical documentation. Yeah. I think that's that at least in the past was definitely a deficit in a lot of people's training. And of course, what documentation has over the last 20 years and what's required has changed and increased. So I think that's definitely an important.
Would you consider boundary issues part of the ethical? I just know how important that is.
Ethical issues. Yeah, I mean, we could put such as boundaries. That's definitely.
It doesn't have to. I'm just trying to think of like things that maybe I somehow missed when I went through school or whatever. It's like, I don't really remember talking about that. That I kind of wish had been.
Yeah. I had a supervisee very early in her supervision who wanted to take her client out to lunch. And I wondered whether boundaries had been covered very well in her program. So that's a good point. Yeah, I've made a note of that. There's one other thing that wasn't sent to you, but that Eric and I thought would be really helpful to put in the manual. At our offsite BSRB meeting, we had a timeline for licensure. So from the point that you apply for your LSCSW, what happens, what the steps are. And we thought that was really helpful because a lot at the same time that these new regs were or statute was passed that lowered the requirements for clinical social workers, they also they were trying to get rules passed about how quickly your license would be decided, or how quickly you would get a decision on your licensure. And they did, in fact, there were some changes where you can apply for an expedited decision, and you pay extra for that. And you have to give the board has to tell you within, is it 60 days, David, or 45?
When that process is fully implemented, basically within 15 days after
15.
The information we need, it'll be that you would get a decision. So.
Yeah. So of course, most of the people that had delays in getting their license, getting a decision on their license, were ones that where their school didn't send the transcript, or there was some delay in the board receiving all the necessary materials. So we've got that concern as well. And so having this timeline that shows what has to happen for you to get your license from the point you apply until the point you get a decision, I think would be really helpful for both supervisors and supervisees. So we wanted to include that one in the manual as well. Do you happen to have that to put up, David?
I don't know that I have
Have
that.
it on your laptop. Okay, that's
But
fine.
I can tell you, we are, kind of, so not every agent, not every profession has a supervision manual, but we are working on those types of pictures or, at least 1 or 2 page type thing for all the professions, just to give people a better idea of sort of what are the steps involved. And, because there are certain periods that are outside of our control, like if someone takes their licensing test, some of the professions, those scores get reported to us very quickly. Other ones, they wait and verify them at the end of the month, and then we get them later. So we're just trying to spotlight some of those things and give more visibility to some of the factors that may be outside of our control that may, play a part in why it takes the length that it does for some people.
Okay. Okay, any other comments, questions, additions, deletions?
Yes, I was trying to unmute. Going back to that list, and I don't know if this falls under ethics, but telehealth.
Yes,
Would that fall under,
that's a really good point, since there's so much more service being provided via telehealth. We talked about that, Dave or Eric, didn't we? I guess we didn't get that on the list, but yeah, I
I
agree.
say we did talk about it, but we had a discussion covering a multitude of these topics. We just
Mhm.
sort of tried to condense them down so the
Mhm.
document didn't end up being 25 pages. And
Exactly.
we also wanted to be respectful of like the providers of supervision and that some of their ability to autonomously determine what they think is appropriate for their supervision provision. So we wanted to strike a balance between support but autonomy.
Yeah, good point. I think in probably a majority of roles, there would be some, but maybe we should just say technology. Add something about technology, or do you think that Eric, do you think that should just be something that's individualized as
I don't think there's any reason not to include technology. I think that does fall under the ethics somewhat, but I mean, when you're talking about consent for provision, knowing that, just your average Zoom doesn't
right?
cover confidentiality, things like that are going to be important. So I think, use of technology and provision of service and supervision, I think could easily be
Mhm.
one that would cover an awful lot of the things that need to be covered.
Should we have
I
HIPAA
would,
in there?
So two people talked at once and I didn't hear that.
I was saying, should we have HIPAA in there?
Again, to me, that goes into the ethical issues. HIPAA comes into regard there for me. But again, I think we can make the list as inclusive as people want to do.
yeah, and you could use ethical issues and in brackets or parentheses, and then identify technology. You got
Such as,
texting,
right?
but you have texting, you have email, you have the telehealth, and you have HIPAA. Yeah, I don't know. There's probably other, I think of diversity, equity, inclusion kind of issues. Since we didn't make that a separate requirement and are putting it under ethics, it's almost like a cultural relevancy somehow needs to be, or cultural sensitivity somehow needs to be in there.
Cultural competence.
Yeah. But that could be under the ethical issues too. Or I
Right.
guess you have a separate issue, cultural competency. But it's not really specifically referring to diversity, equity, inclusion, or
Right.
it we definitely have a lot of issues with that.
Well, I think references to DIE are not supposed to be in any state documents. Do I understand that correctly, David? Or am I conflating with another state that did that?
Most of the conversation has been on higher education from what I have heard, although there have been comments on how, questions about how far that does extend. So I'm not sure exactly how far that extends.
So I think cultural competence is maybe a safer term for us to include in a document that's going to be part of our website, be on our website.
One thing
Awareness.
that I was thinking of with cultural competence is, and I don't remember if it was a University of Kansas or a CEU thing, but they're talking about doing away with that terminology because they say that people can never be truly culturally competent. So I'm wondering if cultural awareness or cultural
Okay.
humility is one that I've heard an awful lot of that's been bounced
Yes.
around as a synonym for cultural competence. So you might want to look that over to
That's a
determine
good
if
point.
that's terminology.
Cultural awareness. And I've seen cultural humility in a couple of CE events recently. Excuse me. Any other thoughts? What I will do is go back in and add these suggestions, and then we'll have hopefully a final draft at our next meeting that you all can take a look at and approve before we put it on the website. And if any of you have other thoughts in the interim, please email me or Eric and let us know, or Andrea, and let us know what your thought is, that we can add that in before our next meeting. So thanks very much for all that feedback. Okay, David, you want to go ahead and do our training now? It's about 11:30.
We can go ahead and kind of break that into two pieces so we can do the first half of this meeting and then touch upon anything we have left. The topic that is also on the agenda that does discuss, the three different reports that were commissioned on the ASWB report. Those are really an important topic for the advisory committee to discuss, but I think you're right. I don't want to shortchange that conversation or cut people short in being able to discuss those. So maybe we can just continue those to the next meeting.
Yes, that's what I would propose.
Okay. Well, I'll go ahead and share my screen here. We do this training about once a year for each of the advisory committees and also for board members. Some of this training is going to be, more relevant to board members or advisory committee members, but I do think understanding this process does help both board members and advisory committee members because it puts everything into perspective. And there is some language in the advisory committee policy that does talk about the policies and procedures that relate to board members should also apply to advisory committee members. So, Eric, I saw your hand was up. You have a question?
Yeah, it was just in reference to talking about putting it off since we approved the minutes and that was in there. Do we need to put a motion and a second out there to say we're going to delay talking about the studies?
It's a good question. So basically, at the top of the agenda, we always include some language that says the Behavioral Sciences Regulatory Board may take items out of order as necessary. All times and items are subject to change. So that sort of preserves our ability to modify things as needed based on discussion times and other factors. Good question, though. So we do have the training for you. It's going to look a little different than past years, but a lot of the same subject matter, but we did provide some updates for you. So just to frame the conversation, the BSRB as a state agency and the mission of the agency in accordance with the intent of the Kansas legislature is to protect and serve the consumers of services offered by BSRB licensees. And that's through the issuance of licenses, resolutions of complaints, and creation of appropriate regulations, accomplished through efficiency, fairness, and respect to all those involved. And so while we do spend the majority of our time working with licensees and applicants, it is important to remember that the agency is first and foremost charged to protect consumers of services. So that makes us a public protection agency. A little bit of the history of the BSRB. The agency was established in 1980 to license and regulate psychologists and social workers in Kansas. At that time, the legislature took the two separate bodies of the State Board of Examiners of Psychologists and the Board of Social Work Examiners and put those two groups together. And then over the years, the BSRB's jurisdiction for 5 other professions has been expanded when those professions basically became licensed. And that is professional counselors, master's level psychologists, marriage and family therapists, addiction counselors, and also behavior analysts. We talked about this a little bit earlier in the meeting, but the BSRB is sometimes known as a composite board. And this is basically, instead of having a separate board for each individual profession, there is one board composed of both professional and public members. And the combination of individuals that serve on the board makes it composite. One of the benefits of having an agency structured this way is that we can save on operational expenses by sharing resources and also utilizing licensing and investigative staff for similar subject areas. One way to better understand the BSRB as opposed to associations, state regulatory boards exist to protect consumers, are created by the legislature, governed by statute, whereas associations exist to enhance or promote professions and are sometimes created by members of those professions. In terms of the BSRB itself, we have 12 staff members, including myself, an assistant director and licensing manager, licensing specialist, investigators, and also clerical staff. We are a fee-funded agency. That means we don't receive any money from the state general fund, but by statute, all the revenue that we receive from things like license fees, we contribute back to the state general fund to help fund other operations. And that's up to a cap of or a max of $100,000 per year. The agency earns its revenue primarily from licensing fees, and the annual budget for the BSRB is about $1.1 million. All board members are appointed by the governor to serve a 4-year term, and board members may be reappointed for a second term, allowing for service on the board a maximum of 8 consecutive years. The statute that defines the board members does say that there will be 1 addiction counselor, 1 marriage and family therapist, 1 master's level psychologist, 1 professional counselor, 2 licensed psychologists, 2 social workers, and 4 public members. There are 2 basic functions of the BSRB, licensing and also investigation of complaints or discipline. Every full board meeting, we provide the board with an updated count of all the permanent licensees under the board's jurisdiction. Each one of those acronyms represents a separate level of licensure for the different professions that we oversee. And there's almost, well, now there probably is over 16,000 active permanent licenses across the professions. The largest group is social work. Social workers make up about 55% of the total licensees under the BSRB. I think professional counseling is likely next with about 2,500 or so. I mentioned licensing, investigation, and discipline is another important area the board oversees. As a public protection agency, the BSRB investigates complaints against practitioners under authority of the board. The agency has administrative authority over practitioners, but that process does not take the place of criminal nor of civil proceedings. In fiscal year 2024, the BSRB received 162 complaints or reports of alleged violation against practitioners, which is about 38 less than in fiscal year 2023. In terms of the investigative process, complaints are reviewed to determine whether the BSRB has jurisdiction over the issue and whether the matter involves a potential violation of the statutes and regulations for the profession. Complaints are reviewed by a subset of the board, named the Complaint Review Committee or the CRC. Some of the common violations that we see: falsifying continuing education requirements or audit violations, practicing without a license or with an expired license, having a dual relationship with a client or a conflict of interest, making sexual advances towards or engaging in physical intimacy with any client, refusing to report a termination or suspension for specific reasons, confidentiality violations, or practice-related issues, such as performing services inconsistent with one's education or accepted professional standards. While licensing and discipline are 2 of our important roles, we also work hard on outreach. So in my role as executive director, I, along with the assistant director and licensing manager, speak to groups of students to provide information on licensing and disciplinary matters, to provide a proactive approach to assist individuals before they become licensed. In addition to meeting with different groups, specifically students, we launched a BSRB YouTube channel back in January of 2021. Since that point, we have now broadcast live or uploaded after the fact over 180 meetings, and those meetings have now been viewed over 10,000 times. We have additional resources on the BSRB website, that is ksbsrb.ks.gov. Some of the features on the website include the license renewal portal, where people can renew their license electronically, copies of forms and other application materials, statutes and regulations, proposed changes to statutes and regulations, the complaint and reports of alleged violation forms, disciplinary orders when they become public, and then also information on board and advisory committee meetings. The BSRB operates under statutory authority. So here is the hierarchy that we follow. When something becomes law, it becomes part of the statute. And the board statutes are primarily Kansas Statute Annotated, or KSA, 74-7501 through 74-7511. There's also a separate statute for each profession, including the Practice Act and then several others. All of those are linked on the BSRB website, divided between different professions. Secondarily to the statutes come as a result of bills being passed. Regulations are, we'll talk about a little bit later in the training, but regulations are something that the agency is able to put through the process to define something more clearly or to explain something that was authorized by law. And there are separate regulations for each profession. And then third, agencies have the ability to adopt policies, and those are adopted by the board or agency to assist with operations. I included a few other documents in your packet of material. I'll touch upon some of the items included in the expectations of board members document. So this is something that is a policy of the BSRB. It was something that board members of the BSRB chose to adopt as expectations of board members some time ago, and then it was revised just about 2 or 3 years ago. Under the guiding principles section of that document, it states that persons in Kansas shall expect that licensed mental health providers are qualified, competent, and professional, that persons regulated by the BSRB shall expect equitable and fair treatment in relation to licensing activities, disciplinary processes, and administrative regulations. The BSRB shall provide all services in a manner that is timely, cost-efficient, courteous, and competent. The BSRB shall be guided and led by ethical principles, clear policies, progressive thinking, and strategic decision-making. And the BSRB shall respect the dignity and worth of all individuals. In terms of BSRB services, the BSRB should process license applications and license renewals in a timely manner, take disciplinary action when appropriate, provide timely information to the public, maintain rules and regulations and statutes. And in that document that talks about guidelines for board members, there were some different values the board wanted to stress. And one of those items the board wanted to stress was the principle of integrity. The board member expectations of the board members document does say that a board member of the BSRB should have no criminal or professional misconduct record, nor commit acts that would lead to investigations or complaints, possesses sound moral principles, being upright, honest, and sincere, has courage of convictions to withstand pressures to be swayed from the public protection agenda, should be honest about personal agendas and leave them outside the boardroom, should reveal any actual or perceived conflicts of interest and appropriately recuse themselves from decisions or actions in those areas of interest, should not represent their personal opinion of that of the board, and should be limited to 1 unexcused absence per year. Concerning conflicts of interest, the board wanted to define these as having any interest, financial or otherwise, direct or indirect, or engaging with any business transaction or professional activity that is substantially a conflict with the proper discharge of the board member's duties in the public interest. It was also noted that board and advisory committee members must make public and recuse themselves from any conflict of interest that exists, and that ensures the integrity of the board in all its decisions. Types of potential conflicts could focus on personal gain, a bias, or effects on personal relationships. Some of the common components of conflicts of interest include a board member of the BSRB should have no personal financial benefit as a result of a service to the BSRB except sustenance and mileage. Board members should, who may have a conflict of interest according to a stated criteria, should refrain from voting on the matter. Board members should disclose any relationship with any other agency or individual involved with the BSRB and be excluded from matters involving such conflict. Board members serving as part of an organization working in any way with the BSRB should inform the board chair. Board members should not accept any gifts or promotional items received as part of their affiliation with the agency for personal use, and board members should not use the agency's name or agency information for personal gain. And we do sometimes get questions about that section of the document. We understand that in your role working with other groups and similar interests, most board members and a lot of advisory committee members may be serving on other committees or with other organizations that may have interests that are a little bit different than the BSRB. The important thing on here is that if you belong to another organization or you're in a role and you feel like membership in that organization may impact your ability to essentially wear this hat, to be an advisory committee member or a board member and perform your services in this way, or vote on a certain matter in a way that is aligning with the BSRB principles, then we would ask that you basically say that there is a conflict of interest and refrain from voting on that. But we leave it up to each board member and advisory committee member in terms of when they identify a conflict of interest in the actions they take in that matter. Concerning personal conflicts, those are actions that may ultimately have a personal consequence that is a direct or indirect effect of a decision or action, and no decisions should be made that will advance the personal benefits of a board or advisory committee member. Concerning confidentiality, information should be protected and must remain confidential during and after board membership. Board discussions involving any of the following matters shall remain confidential unless the board expressly agrees to the contrary. Any discussion that occurs during an executive session and any discussion concerning actual or potential litigation. Other examples of times when confidential information can be discussed, that is when you are in an executive session after leaving an open meeting, or deliberations after a hearing. Deliberations after a hearing are primarily related to the board members and their role serving as a hearing panel. So probably in your advisory committee role, that's not something you're going to be doing too often. In concerning executive sessions, if you are not used to being a part of an organization like the BSRB, if we ever were to go into an executive session, we would make it very clear that that is what we are doing. There would need to be a formal motion to go into executive session. It would have to be for a reason identified in statute that we are authorized to go into executive session. And then the meeting would continue without any of us on the call still. We would go to a separate forum, maybe a confidential phone call, discuss the item in the executive session, and then return to the meeting. So should that ever occur, we'll walk you through that process, but any information that is discussed during the executive session should stay confidential. In terms of the authority for the BSRB, the board chair shall preside at all meetings, appoint members to the advisory committees, appoint members to the complaint review committee, and appoint members to other ad hoc committees. The vice chair shall discharge the duties of the chair in his or her absence, disability, resignation, or death. The expectations of board members document does outline some information concerning the board and executive director relationship. Under the organizational structure, the executive director will communicate any personnel matters that should be addressed to the board to the chair of the board. The chair of the board will communicate or present these board-related issues to the board, and the executive director will communicate to the staff the board's wishes, intentions, policies, etc. And that is accomplished through staff meetings here at the BSRB office. In terms of the executive expectations, the executive director shall keep the board advised of BSRB activities by issuing a report to the board at each full board meeting, which summarizes pertinent information. The executive director shall prepare the agenda for board meetings in consultation with the board chair, and the executive director shall prepare the agenda in consultation with the board chair for an annual board retreat, which shall allow for issues before the board that require in-depth consideration. We usually refer to this board retreat as the out-of-town planning meeting, and we do still hold that annually. Additionally, there is a delegation to the executive director. The executive director shall be the administrative head of the organization, serving under the board at all times. The executive director is responsible for implementing and executing the policies and activities approved by the board, and shall recommend policies and activities for consideration by the board. The executive director shall also have sole authority to employ, eliminate, and fix the duties and salaries of other employees or independent contractors of the organization, subject to policies, regulations, and limitations approved by the state of Kansas. And so anytime that I would want to hire someone for the BSRB, we would need to have an open position that we could hire someone into. And then any person that I wanted to hire, I would need to propose a certain salary for that individual. have that approved by the Department of Administration, and then ultimately the governor's office, as we are an executive level agency. And so there are some checks in that process. It does talk about monitoring the executive director's performance. The board shall, when necessary, utilize executive session to discuss issues concerning the executive director. The board shall formally evaluate the performance of the executive director each calendar year and on an annual basis thereafter, with emphasis on whether set outcomes are attained. And so the board does provide a performance review for me each year, and I think that's a really good policy. We meet with our staff members and we try to provide them feedback at least once a year through the formal process as well. Turning next to the next document in your packet, you have an advisory committee policy. That is a short document. It's just about a little over 1 page long. And most of this document provides information on the advisory committee purpose, and that is to support the board in carrying out its mission to protect the public. The way that the advisory committee fulfills this process is by addressing issues referred to them by the board, or the advisory committees may suggest issues that believe the board should consider by referring them through the chair of the advisory committee back to the board. And once an issue is referred to the board has 3 options. 1, address the issue at the board level. 2, refer the issue back to the advisory committee for additional information. Or 3, not take any action on the issue. The document also explains the structure of the advisory committees. The chair of the advisory committee is a board member. A public board member will be a member of the advisory committee. There will be a minimum of 3 and a maximum of 10 additional advisory committee members. The executive director is a non-voting ex officio member. The assistant director and licensing manager is encouraged to attend advisory committee meetings, and legal counsel representing the board should attend meetings when their attendance is requested. Terms of the advisory committee are 2 years, and advisory committee members are appointed by the board chair. They can serve, this is a recent change, advisory committee members can serve up to 8 terms with a 2-year break in between their 4th and 5th term. So up until recently, what it said was advisory committee members can serve up to 4 2-year terms for a maximum length of 8 years of service in the advisory committee of 8 years of service. But there was a request to consider if individuals had previously served in the advisory committee and would like to come back and continue to serve, might there be a path for them? And so what was changed in the language for the advisory committee policy was to say, if you have served on an advisory committee for 4 terms, you need to wait at least 2 years, and then you can reapply for consideration to be appointed back to the advisory committee. And if you are reappointed, you could be able to serve basically those 4 additional terms. So now you can serve up to 16 years as long as there's a 2-year break, at least partway through. And it is recommended that appointments to the advisory committees are staggered to avoid too many members reaching their maximum length of service at the same time. And then the language I talked about at the very beginning, the policies and procedures under which the BSRB board members are expected to operate will also apply to the advisory committee members. There are going to be some differences just based on the nature of, the 2 different groups being a little bit different. And so there's not the same specificity of language as there is in the statute in terms of qualifications for advisory committee members. So there's a little bit more flexibility on who can serve on an advisory committee. But what I would take from this language would say, when you're looking at the expectations of a board members document, and they're talking about the ethical principles, such as making sure you're avoiding conflicts of interest and things like that, I would take those to heart and try to fulfill those as a board member would themselves. In terms of selection of advisory committee members, nominations can be made by the public, committee members, members of a professional organization, or through self-nomination. Committees should ensure diverse representation, including geographic setting, gender, culture, ethnicity, and licensing levels. Members should represent both public and private sectors, as well as educators in the discipline. And the committee reviews nominations or nominees' resumes, letters of interest, and their alignment with the board's goals and mission. The committee chair submits recommendations to the BSRB board chair for approval. And then once appointed, the executive director informs new members and may provide orientation to familiarize themselves with the board and committee's roles and functions. Last document you have in your packet is a 1-page document front and back. As we have been broadcasting our meetings on the YouTube channel and we've done additional outreach talking to different groups of students, we've had a lot more questions from people, which is great. But there have also been a lot more people wanting to attend BSRB meetings and provide public comment. And so we thought it'd be helpful to develop a short document to explain that process in a little bit more detail. So it is an official policy document. It's posted on the BSRB website. It does explain that public comment is not entitled to individuals, but they can request that, and it may be approved by the chair of the board or the chair of the advisory committee. It does also outline the processes that should be followed during comments to the board or advisory committees, and also topics relevant for public comment. So there may be information helpful for the board to receive, but receiving that information during a public comment section may not always be the best way for us to receive that information. So we wanted to kind of clarify those things a little bit better for members of the public. Now, the next section does start on some training under general guidance for state agencies, but I think maybe it would be helpful to kind of pause here and see if there's any questions, and then we would have a little bit of time to take care of a couple other items on the agenda. So maybe we can pause here for the first half of the training, answer any questions, and then do the second half of the training at the next meeting. I'll stop sharing my screen to see if there's anybody who has any questions so far.
All pretty clear. I like the way that it was condensed and reshaped.
Thanks, Cynthia. Yeah, the next part of the training really goes into some of the differences between, if some of you have served on, for-profit or nonprofit organizations, you may be asked to follow a little bit different rules than we do as a state agency. So it goes into a little bit of the information about the Kansas Open Meetings Act, the Kansas Open Records Act. There may be times to where we're dealing with confidential information about a specific applicant or about a disciplinary matter involving a specific person. Those are done under the Kansas Administrative Procedures Act, which are not public forums. But the big takeaway I want you to get from that today, one of the main questions we have when we talk about the Kansas Open Meetings Act is sometimes, there are certain rules that basically prohibit the advisory committee members from all working together outside of a public meeting in sometimes. So basically, a real quick, under the Kansas Open Meetings Act, it basically says if you have the majority of members of a committee that is under the KOMA, or the Kansas Open Meetings Act, if you have a majority of members of the committee that are having interactive communication, whether that is in person, by phone, by electronic process, by email, if you have that interactive component and it involves the subject matter for that committee, it involves something related to the work of that committee under the law, that needs to be done in a public meeting. And so that's why we can't have emails back and forth where we work on something as an advisory committee outside of the meeting in preparation for these meetings. Now, there can be, if there's something that involves less than half of the members of the committee, that is perfectly fine. We can have, a few people work on something, bring that to the committee, that works out fine. You just have to make sure it doesn't involve the majority of members of a committee. You could have the majority of individuals on the advisory committee come together and go out to dinner because you are having interactive communication. It is a majority of members, but you're not talking about the topics relevant to the work of the committee. So you do have to be very diligent avoiding those kind of topics, but that would be okay too. But that's the big takeaway. And some people, they want to be very cautious, which is great, and avoid any kind of issues. And so they're concerned, can I contact the executive director? Can I contact the co-chairs? You can always do that. There's no problem there. Just always a good idea to avoid hitting reply all and communicating something back and forth with members of the committee. But if you ever have individual questions, just send an email directly to, Andrea, Cynthia, or myself, and we'll go into more details there too. Concerning the Open Records Act, if there's information relevant to your work on the advisory committee, a lot of that information could be regarded as a record. So you're all professionals, but we always like to remind people that even things like emails are regarded as records. So always make sure that you're using professional language. And if there's anything in an email communication, just, try to make sure that it's not something that you would feel embarrassed about if it was published in a paper or something like that. So I know you've all probably heard that kind of reminder about records in the past, but we are subject to the Kansas Open Records Act. And so we do take care of that on behalf of the board and the advisory committee. But that is something just to bring to your attention. So we'll go into more detail about those specific requirements at the next meeting. But if there's no other questions, then I guess I'll just turn it back over to Cynthia.
Great. Well, that was quite efficient use of time. Thank you, David. We have about 6 minutes left. I don't think that that's enough time for us to start diving into the reports on the ASWB licensing exam. So I think we'll continue to hold that for the next meeting. The other thing under new business was a discussion on standard meeting date and time. And we have been meeting on every other month on I believe the first Tuesday or second.
It's usually been the second Tuesday.
Second Tuesday of the month, and from 10 to 12 a.m. And so that we can continue with that if that's agreeable to everyone. Does anybody have an issue with that day of the month or time? This would be 6 meetings a year on a second Tuesday, although in February, I think we are, on February, we're going to the third. We need to make an adjustment that month because I'm going to be out of town. So Feb 18 will be our next meeting, which is on your agenda. But going forward then, for the rest of the year, we'd like to do 10 to 12, the second Tuesday of the month, if that works for everyone. So does anybody have an issue with that day or of the month or that time, 10 to 12? Would you want it to be at a different time? Do we need a motion and to pass that just by consensus?
There's consensus. It'd be fine. Yeah.
Okay. If no one has any objections, we'll plan that way going forward. And our next meeting will be on Tuesday, February 18th at 10 a.m. And in the meantime, I hope everyone has a wonderful holiday season and that we don't get too much ice or snow and that you are able to gather with friends and family and enjoy the season.
Yeah. Thank you all for your hard work this year. Look forward to working with you more in 2025.
I motion to adjourn.
Do I hear a second?
Second.
All in favor?
Aye.
Aye.
We are adjourned. Take care. See you in February. Bye-bye.
Bye now.
Bye-bye.